Hi, I'm Dr. Krishna Prabhakaran from Vaidya Healthcare. The topic today we are discussing is cerebral palsy. Cerebral palsy refers to a group of disorders which affects the muscle movement and coordination. Most common disease which can be seen in the early childhood or which can be seen during the early childhood days. The symptoms of this condition or cerebral palsy varies from person to person and mild to severe. Different symptoms may be different to different person, such as for some person it will be very difficult in grasping things. For some person it will be very difficult to sit or stand independently. Hence, a set of symptoms for different persons will be different. Even though different symptoms are there, the most common symptoms which we are noting as first one is the delayed milestone. Delayed milestone is the major symptom by which we diagnose the disease in the early childhood days. Next one will be the difference in or altered muscle tone, and next one may be difficulty in sitting, standing, etc. Other symptoms are also being included, like drooling may be there, or excessive visual difficulty or hearing difficulties, etc. can also be seen in such conditions, but the main symptoms which we note as will be this one. Even the etiology of this condition is not known yet, but the cause which we are noting will be the atypical brain development and the damage which is happening to the brain, which can happen during or before or just after the childbirth. These damage which can mainly happen in certain centers of brain which are coordinating or which are managing the motor activity, coordination and posture of an individual. Mainly there are 4 types of cerebral palsy depending on the symptoms which the patient shows. They are spastic one, hypertonic one, dyskinetic one and mixed variety. For different symptoms for different varieties there will be different set of symptoms. Here in Vaidya Healthcare, we are providing specific Ayurvedic Panchakarma treatment for such conditions with the help of physiotherapy, behavioral therapy, speech therapy and occupational therapy if needed, depends on the patient. Main herbal medications which we are using in such conditions include Vaidya drugs. These Vaidya drugs are having a specific action on the functional activities of the brain, and some Majjavardhaka drugs. These are also having certain action on the brain and hence will helps in managing the brain development or managing these difficulties. The next one is the external therapies, which will include Kerala therapies and also Ayurvedic Panchakarma therapies. These include Abhyanga, Shastika Bandhaspeda, Basti, etc. And these all will help in improving the motor activities of a person. We also provide physiotherapy, which is specifically pediatric physiotherapy is provided in such cases. This will improve the motor ability or it improves the motor activity of an individual, hence improving the motor coordination and making him adaptable to the day-to-day activities. Even though we cannot completely cure the cerebral palsy, but we can maintain well these conditions with the help of these all treatments. Thank you.